Admissions are expected to begin at the new COVID-19 treatment center at the Kumasi South Hospital next Monday. The addition of 20 beds will increase the facility's current 21-bed capacity to 41, and that will make it the biggest treatment center in the Ashanti region as authorities push to expand COVID-19 treatment centers, which is what we're being told we have to do. A medical superintendent of the Kumasi South Hospital, Dr. Ofoyi, has been taking my colleague Ohime Teria on a tour of the new treatment center. He says additional equipment are also needed and they are being procured to resource the center.
Expansion works come a day after Regional Health Directorate announced all treatment centers at the Komfanoche and Kumasi South hospitals are full. This means the current 38-bed facilities are inadequate. Authorities say additional 100 beds at Kumasi South, Suntreso and the private facility will be added to increase the current capacity to 138 beds. A visit to the Kumasi South Hospital, however, shows artisans were busy working to put the facility in shape. Dr. Ofoyi says maintenance works are expected to be completed over the weekend to allow admission of new patients on Monday.
It's estimated that Saturday this place should be ready so that we can admit cases to this ward. So by Monday, we should be admitting cases here.
So help us understand exactly the work that is left to be completed here at this new facility.
The soil has some amount of water, so you see the water absorbing into the block again. So we do this with the plasterings, a few plumbing work, and then the entry and then exit for staff so that we don't contaminate ourselves in our bid to save the confirmed cases. The materials have already been procured, so I am 99% sure that indeed we can complete this Saturday.
Kumasi South, which is also the regional hospital, has until the emergence of COVID-19 faced with infrastructure and human resource challenges. Dr. Boadu, who admits the facility is overstretched, says there has been realignment at the facility to meet the current demands.
We will have to do a bit more than we are doing to be able to sustain and our efforts and then contain the virus. Like I keep telling my staff, if we do not stop or curtail the movement of the virus outside, it will come into our homes to kill us. So yes, we are overwhelmed, but the march and then the fight goes on.
From Kumasi, for JoyNews, Ohime Teria reporting.
And Ohime will be joining me live, so we get an idea of the situation on the ground right now as we speak. But more of your messages whilst I get on to Ohime. This one says, Gifty, the situation we're in is a pandemic. I think government must be blamed, but the solution is government must engage NGOs and CSOs with a dedicated fund to promote education, awareness and behavioral change to ensure that people live or wear the mask. Isaac Ampoma is a concerned health education NGO. Sending that. You also say that a meeting of CSOs at all district assemblies must be convened to strategize on education and behavioral changes. And you talk about how we've done that with TB, HIV, malaria, why not COVID? Thank you for sending that message in. But one key thing that keeps coming up is the need for community engagement and education. And I hope that the people that ought to take these measures are actually listening. This one says, if my memory serves me right, you want to say, during one of the public addresses by President, he said he might impose a curfew or state of emergency to any of the areas, regions or communities which has recorded higher cases. Now that we have started to experience such, you say, he and his people are encouraging the Electoral Commission to go ahead to organize to compile a new register. His Excellency does not care much for his citizens, but focusing and concerning himself about how to get another 4 years. God save us, Ghana. Osman is sending that from Tamale Central, Dakpen Phone. Thank you, and my regards to everybody that lives there. Let's get on to Ohime Teria, who is joining me live from Kumasi. Ohime, what's the situation at the moment?
Yes, the workers are busily working on the new COVID-19 treatment center at the Kumasi South Hospital. As at the time I was leaving, they were almost done with the day's activity. But according to the authorities at the Kumasi South Hospital, the workers are not closing any moment from now. They will continue to work extra hard to ensure that they put the place in shape for it to be ready by Monday. So they are looking at a Saturday deadline. Once the facility is put in good shape, then they'll start the arrangements of furnishing the facility with beds and the needed equipment, as well as treatment and materials that will be needed for the center.
Ohime, I had a conversation with Fred Smith, head of our health desk right here on the show just a short while ago, and he was talking about lack of funding for a similar structure that's ongoing at the Kolebu Teaching Hospital. Do authorities there talk about the availability of funds to get this done and ready in good time?
Yes, they did. The medical superintendent, Dr. Ofori-Boadu, talked about the fact that the Regional Health Directorate has made funds available. And beyond this, they've also procured all the needed building materials to facilitate the refurbishment and also the maintenance of the facility to put it in good shape. So for them, funds is not an issue, but the only issue has to do with the work that they have to also support the workers, artisans, to ensure that it will be completed on time. It seems they are in a hurry because the Ashanti region, as we speak, all the treatment centers are full. The Kumasi Teaching Hospital, which has 8 beds, is currently full, as well as the Kumasi South Regional Hospital, which also has 22 beds. So once this one is completed, it means the Kumasi South facility will have 41 beds, plus another 7 from the Suntreso Government Hospital. And the officials have also been negotiating and speaking to a private man so that they use his facility as a treatment center to augment what they have, to increase the number of beds to 138 in the Ashanti region. So I would say, yes, funding could be a constraint elsewhere, but in Ashanti region, it is not.
Well, that's a good thing, and we hope that it goes through up until the end. But Ohime, I read for you a message that's coming in from one of our viewers, and then I ask you a question on the back of that. This one says, the health director at the Ashanti region should come clear on the number of deaths, because the national figures is to confirm and update the site. Sir Jake from Domia Brankaswa saying that. Has there been any update on the case count from the region today?
I'm sure by the case count, we can only be assured of an increase, or maybe the report at the end of the day. Usually the COVID-19 situation reports are released after the day. So after close of work today, then it's expected that the editors, including the regional health director and his 2 deputies, as well as information, and then the biostatisticians will also update us as to the number of cases that have been recorded in the Ashanti region. But the last time I checked, as at yesterday, the region's case count was at 2,405 with 38 deaths. I'm not sure anything has changed until we receive a new report updating us whether we've recorded new cases or not. So I would like to take it like we still have 2,405 cases of COVID-19 positive cases in Ashanti region.
And on the back of that figure, when people get to know that the treatment centers are full, what sentiments are coming up? Yesterday, I think I asked you a similar question. I think it was Erastus rather, about the sentiments that people are sharing. People in Kumasi are sharing about this because the centers there are also attracting people from different regions, I should say. How do people feel about treatment centers being full?
I would say in the Ashanti region, not much has changed as far as people's attitude and concerns are, except that there are few of the health workers, when you speak to them, they are worried, including the Regional Health Directorate. But to residents, they seem not to care about whether our treatment centers are full. For them, once they know the hospital at their locality is available and they can visit the facility anytime they fall sick, that is enough for them. I've spoken to a couple of them who think that, yes, COVID-19 could be around, we shouldn't forget that there are other health conditions that are also plaguing the people. So people seems not to care so much about whether the treatment centers are full or the isolation centers are getting full. All that they care is to go about their businesses and to attend to them as and when they wish. But it's a very dire situation, because in the entire Ashanti region, when you look at the health facilities that are available, apart from Kumasi Teaching Hospital that can handle critically ill patients, the rest of the health facilities can't do same. Unlike in Accra, where you can have the police hospital, the Rage, as well as the 37 military hospital, and even the University of Ghana Medical Center to complement that of the Kolebu Teaching Hospital. All these are non-existent in Ashanti region, and that has been the worry of health officials, that residents have to step up, efforts in ensuring that they live up to the preventive protocols to ensure that they are able to protect themselves. But for residents, not much has changed. It is still the old story that COVID-19 is around, we can live our lives, and when we get it, we can access the nearby health facility.
Ohimhen, thank you for that update. And if you are anywhere in the Ashanti region, or indeed anywhere in this country, I'm making a personal appeal to all of you to do what you can to stay away from this.